Thank you, Mr. Mabaso. Greetings to you and the MEC. May we also extend our greetings to all colleagues, members of the media, government officials who are with us today. Thank you for honoring our invitation to this media briefing. As government of KwaZulu-Natal, we can never grow tired of thanking you for always responding positively whenever we invite you to come and participate in this session. We say this because when it comes to the battle against COVID-19, the sharing of information and changing our ways and behavior is central to our very survival during these trying times. We're meeting here today, and this briefing is taking place a week since His Excellency President Cyril Ramaphosa announced the regrading of South Africa
to risk-adjusted alert level 2. This is a responsible and proactive decision taken by a caring government to protect lives and mitigate the impact of the third wave, which is engulfing the country. We already know that 4 of the 9 provinces of our country are already battling a third wave of infections, which should send a strong signal to all of us to behave responsibly and observe all COVID-19 prevention protocols. But before we get to the purpose of today, which is to provide an update on COVID-19, we must express our pleasure at the fact that KwaZulu-Natal has been chosen by the national government as the host for the commemoration of the Youth Day, and this will take place in Pietermaritzburg on the 16th of June. This is a day of profound socio-economic, socio-political significance, as it reminds us of a long and a painful journey that we have traveled together as the country and the people. It gives us an opportunity to reflect on where we are and where we need to go in pursuit of true and complete emancipation, especially for the youth in the country, to build a bright future for all young generations. We will therefore welcome the President, who will be a keynote speaker, as well as the delegation from our national government. And let's take this opportunity
to also highlight one of the major milestones of our government on youth emancipation, which is the KZN Youth Fund. And as part of Youth Month, we're taking this opportunity to announce that as government of KwaZulu-Natal, we are rolling out the second phase of KwaZulu-Natal Youth Fund. For this purpose, we have set aside an amount to the tune of 50 million rand. This funding will assist many youth-operated businesses in the province. The Office of the Premier, working together with relevant departments, will soon announce the details regarding where young people can send proposals to for their businesses to be considered for this funding. The first phase of this program has already had a great impact in the number of successful youth or operated business ventures that have been formed and ended up thriving through this seed funding. We trust that this new fund will boost the prospects of young people and help them realize their aspiration of becoming entrepreneurs. We also know that COVID-19 has had a serious impact on the economy of the country. The recent Labour quarterly survey has highlighted the severity of the impact that COVID-19 has had on the economy, as reflected in the latest unemployment figures. Despite our constrained economic environment, we are encouraged by a number of recent investments in our province, which include the following: the Nyanza Light Metal, which is the construction of the first phase of the Nyanza Light Metal Titanium Dioxide, which is a pigment production plant, which commenced in March of this year. That investment is valued at about 4.5 billion. Secondly, the Wilma processing, the construction of the 1.3 billion crude vegetable oil refinery, which is a facility that is being constructed in Richards Bay Industrial Development Zone, commenced in October 2020. Currently, civil engineering work are underway at the site, with piling and earthwork nearly completion. Once completed, the facility is set to create 202 jobs. You will remember that we visited Pepco Logistic Facility, which is a 1.5 billion facility at the Keystone Business Park in Hammersdale. We launched this on the 11th of May this year. Construction of this facility is currently underway, and once operational, the facility will create 2,200 jobs. You will know also of the DeFi Warehousing and Distribution Center. And on the 19th May, DeFi South Africa officially opened a 170 million warehousing and distribution center in Ladysmith. The facility has the capacity of loading in excess of 200 trucks per day and a storage capacity of 100,000 cubic meters. It will create 130 new jobs. The business processing outsourcing, this is a call center. The growth of the business processing sector has been phenomenal. About 15,000 jobs have already been created, with the potential for a further 55,000 in the medium term. We have spoken about the Durban Port expansion, which will see about 100 billion invested over the medium term in terms of ensuring that Durban Port is expanded, reduction of congestion, and increasing capacity of the port. Some of you participated also in the signing of the Memorandum of Understanding between KwaZulu-Natal government and the African Bank, which is the Africa Export and Import Bank. This Pan-African Development Financier, which is headquartered in Cairo, in Egypt, is already funding some of the projects in our country and our province, such as Nyanza Light Metal. This MOU will see a new era of investment in the province, which is highlighted by the 20 billion worth of projects which have been presented for consideration for the funding by the bank. All of these developments are warmly welcomed and extremely encouraged. They are like a bandage that will heal the wounds of unemployment and the loss of livelihood that have been as a result of COVID-19. We are quite concerned about the recent development in the Richards Bay minerals. We want to condemn, in strongest terms, the recent incidents of killings and arson at the Richards Bay mineral. As government, we are committed to working with all stakeholders to bring stability in this important economic belt of the province. We have full confidence in the capacity of our law enforcement agencies to bring to justice all those ringleaders behind the economic sabotage that is taking place in and around Richards Bay. On Thursday this week, the Mineral and Energy Minister, Minister Gwede Mantashe, together with a delegation from the provincial government, visited the area to pay respect following the death of one of the senior manager, Nico Swart, who was killed in a very, very brutal way. We continue to send a message to all members of the community to play their role in safeguarding that investment, which is quite critical in the creation of jobs. If RPM collapses, it is people's livelihood that will be severely affected. Let us expose the criminals that are involved in this and rise up against all those who are destabilizing our economy, especially at such a critical time. Coming back to the purpose of today, although there is always room for improvement, we must say that we are quite pleased with how the rate of vaccination has been proceeding in the province. From our 124 vaccination sites so far that we have created, and 18 in the private sector, we have managed to vaccinate a total of 360,451 people in the province. This is made up of 237,195 senior citizens who are above 60 and 123,256 healthcare workers. KwaZulu-Natal Department of Health will be opening a further 21 new vaccination sites this week. And this will be to accommodate educators who will be getting vaccinated from the 9th of June, which is this coming Wednesday. We will be receiving about 110,400 J&J vaccines for this category. We already have a database for these educators which should be vaccinated as the process starts on Thursday. These educators will be guided by the management in their respective districts and circuits regarding which sites to go to in order to get vaccinated. Some districts will also open new sites where sites do not already exist, while others will have to designate their own existing site accordingly to accommodate teachers. We are also exploring the possibility of opening these vaccination sites over weekends because educators work between Monday and Friday. We are also concerned by a few schools which have reported high number of infections within a space of few days. For an example, on Friday, the 4th of June, one school under Umzinyati reported 16 positive cases of learners. Another school under the Utugela district reported 15 positive cases of learners. The Department of Education will continue to implement COVID-19 protocol and to provide necessary PPEs. With regard to the status quo when it comes to COVID-19, the latest information we've gathered over the past 24 hours is that KwaZulu-Natal has recorded 227 cases, bringing the total number of confirmed COVID-19 cases to 340,586. Sadly, we have lost about 10,534 people as the province. The province of KwaZulu-Natal continues to observe an increase in the number of new cases recorded weekly, and that is very concerning. The overall percentage change in the number of new cases between week 21 and week 22 was 24%. The actual number of new cases were 726 for week 21 and 900 for week 22, respectively. Amajuba district is the only district that has reached alert line, and cases have been slightly increasing in the 3 previous weeks. eThekwini has also been receiving the highest number of cases, although it has not reached the alert line. eThekwini continues to contribute the highest percentage of deaths, which is about 36% of the total deaths. And in terms of numbers of those who die at home, it's also worrying because 2% of these 36 are home deaths. The median age for death was 63 years. More than half of the deceased were females, which is about 54%. We continue also to see recoveries, and recoveries stands at 325,295, and active cases are at 4,163. We will present you with a clear detail on the figures per district, but maybe what one can highlight is that in eThekwini right now, the total number of cases stands at 160,241, and the number of deaths is about 3,849. The total number of cases, as I've said, in KwaZulu-Natal stands at 339,992. The total number of deaths, as I said earlier, is 10,534. Now, this tells you of the picture, and if we break this per district, you will see that in terms of active cases, eThekwini, it's at 0.7%, Ilembe 1.4%, Mkungundlovu 1%, uThukela 0.9%, King Cetshwayo 0.3%, Ugu 3%, Amajuba it's 1%, Mkhanyakude 0.1%, Hirikwala 6%, Zululand 4%, Umzinyathi 2.7%, and unallocated is 0.1%. So the active cases in KwaZulu-Natal as a whole stands at 1.2%. Many people have been asking whether the province is in the third wave or not. The answer is that at this stage, we will say no. But in terms of our emergency early warning site, a 10% increase in cases over a 7-day moving average will trigger an alert, while a 20% increase in cases over a 7-day moving average will trigger a resurgence, which may indicate that we are entering a third wave of COVID-19 infections. So we continue to monitor trends and signals of resurgence in the province. Our focus is on identifying clusters and conducting targeted testing in the affected areas identifying and strengthening contact tracing, intensifying our risk communication drive with an emphasis on non-pharmaceutical interventions. Our strategy to deal with the potential third wave stands on the following pillars: testing all COVID-19 suspected cases and their contact, isolation of confirmed cases, monitoring of those who are self-isolating, tracing all contacts of the confirmed cases, dedicating beds for quarantine and isolation as well as ICU, ensuring oxygen availability, accelerating vaccination. So this is the totality of the plan to curb the third wave. In conclusion, our main focus now is to accelerate vaccination and stay highly prepared should a third wave hit us. We are calling on techno-savvy citizens to assist with registration of our elderly and the rural poor. We have directed that all MEC champions, mayors, and Operation Sugumasake war rooms dedicate a week in their respective districts and ward to monitor and facilitate registration for vaccines. Each one must register and each one must take vaccine. Even though our province has not entered the third wave of COVID-19, we should nevertheless remain vigilant and acutely aware of the potential risk of a resurgence of infections. We cannot overemphasize this. It is crucial for us to adhere to the non-pharmaceutical interventions, such as wearing of masks, maintaining social distancing, and washing our hands regularly with soap and water, or use sanitizer. Our memories are still fresh, and we have barely recovered from the tragic episodes of the first and the second waves. It is now proven that individual behavior, such as getting into large gatherings and crowded spaces, spreads the virus fast, and it moves quickly among many people. We urge all citizens to adhere to the level 2 regulations, which are indeed and are intended to keep us out of the third wave. Let us continue to limit our movement. The vaccine is safe, and therefore we call on all people to register, including the fact that the walk-ins are accepted, and when people come in, they get registered, and then they get vaccination. If your turn has come and you have been notified, please go and get vaccinated, because this is our only hope to stop the spread of the virus and save lives. It is up to you and I to ensure that the relatively low number of infections that we are currently seeing, though it is increasing, should not escalate. It is up to us to ensure that we curb the spread and not hit the storm. Let us save the day by doing what is right, and all of us should adhere to non-pharmaceutical measures and go to vaccinate when our turn comes. I thank you.
Thank you very much, I'm going to open for the questions from the colleagues that are here in the room. I'll get an indication if there are colleagues that want to ask questions from the online platform. I'll start with the colleagues here. See if you have your hands, starting with you, Mrs. Lana, colleague here, and Mrs. Sheila. So the interviews are here, so don't want to do that.
I think my voice is loud enough. More Michael Lane from East Africa. Premier, I'm interested to know as to, we're not the third wave yet, but it might be going there. Is there a way of studying from the previous waves of how you can minimize the impact of that? Because we've talked about the lives lost and the economy, that we don't go back again to a devastating situation and also levels being have to raise of the lockdown. And then MEC, for you also, in terms of the rollout, you see now that there's an issue with the minister is involved in the scandal with digital vibes. Are you concerned anyway that maybe if he were to lose a job or something that might impact the way that the province gets its vaccines from the department also? Might that have an impact in how KwaZulu-Natal communicates with the National Department of Health? And then number two, we have some experts who say that we might be already in the third wave because they analyze the sewer situations. Have you seen that? Are you communicating with them to try to understand as to how they got to that conclusion, seeing that you are already saying that we're not there yet, but we might be heading there? Thank you.
Service from the witness. I just have two questions for the Health MEC. Just the first question, I'm curious. The Premier said that more females than males have died. I can understand if you don't have the answer right now, but I'm just curious. Is there sort of any reason why disproportionately more females than males have died from COVID-19? And my second question is regarding the vaccination sites. I think we've all seen in the media that there are some vaccination sites for old people where there was a lot of crowding and it could have been unsafe. Like, what is the department sort of doing to make vaccination sites not turn into places where people can actually just contract the virus, especially as we move on to the next stage?
Thank you.
Sheila Mhlongo from mhlambe ku MEC for Health ukuthi njengoba othisha bezothola ukuthi bagonywe kuleli hlandla lamanje mhlambe kuzobe kubhekwa othisha mhlambe abanezifo vele ezibahluphayo noma kuzobe kubhekwa nje bonke nje othisha ukuthi bathole umgomo?
Yes, my name is Busi Kumar from SABC News. The Premier said that there's more than 153,000 healthcare workers who have been vaccinated in the state from the phase 1 category. As far as we know, the target should have been completed by end of May of vaccinating all or almost all the healthcare workers. So what were the problems that led to the government not being able to complete or to meet that target? And also, are you confident that the current phase 2, are you going to be able to complete your target by September? Thank you very much. I'll hand over to the Premier.
I think MEC can start. It's better. Allow.
Thank you very much. Good afternoon, Premier. Good afternoon to the colleagues. And thank you very much for the opportunity. Maybe, Premier, let me start with the last question from Uvusi, which was saying we had a target that we have put in place for ourselves and we have not been able to vaccinate the total number of our health workers. And it is correct. We've not been able to do so for a number of reasons. The first one is that it's not all the health workers that are willing to take the vaccination. As a result, we have had to follow some of them and try and get them to buy into the idea of vaccinating. Understanding that we have always insisted and have always indicated that vaccination, no one is going to be compelled to take the vaccination, but we mobilize and want people to do so of their own volition. So where health workers have not been willing to take the vaccination, we have not been able to force them to take the vaccination. That is the first issue that affects us. But the second one was the availability of the vaccines themselves. We were not able to receive the total amount as and when we needed it for us to be able to conclude the health workers that we needed to vaccinate. But now we have then, we are starting to move. But the third factor is that the health workers in the private sector in particular, when we started opening, we had a challenge in that some of those that are running private practices were beginning to register their families as if they are employed within their own practices. For instance, you then have a doctor that come with a wife who, according to the system, is registered as an administrator, and one of the sons and the daughters would be registered as a PA or someone who works within the factory. As a result, the national department, in about 14 days ago, then decided to close down the system that had registered the health workers because they needed to deal with that issue. It's not an issue that was just happening in the province, but it's a problem that was happening nationwide. So all of that affected our targets. However, we are sure that by the end of June, we would have completed all the health workers that are willing to be vaccinated, because those that are not willing, we are unable to actually force them. So those have been some of our challenges that we were faced with when it comes to the vaccination of health workers. But I must indicate that there are other facilities that have actually, we would say, have reached their maximum. I'd give you an example. Letandi Hospital, they've reached 98% of vaccination of health workers, and the 2% are only those that have not been willing to come forward. Of course, there are engagements there, but like I said, we will never be able to actually force them. So, Ubonga, your question is that, is there anything that we can do to minimize the impacts of the third wave? Look, the point that the Premier is raising, and it's something that all of us need to speak to our communities about, is to ensure that we continue to adhere to the non-pharmaceutical interventions, which means that we continue to wear our mask, we continue to wash our hands, and we continue to maintain social distancing. I must indicate that within the last week, we received a report from the Justice Cluster that was indicating that in other areas, some events coordinators have begun to mobilize or organize events that would have more than 1,900 people and so forth. And in that meeting, we agreed that if that continues unabated, it means we are certainly setting ourselves up for a third wave. And there is no way you can maintain social distancing when you have 1,700 people in one space. So we agreed with MEC Nkonyeni, who's leader of the Justice Cluster, that the security cluster will ensure that regulations are implemented. So we call on our people, particularly young people who are beginning to attend these events, to stay away for now. I mean, we know that it is very restrictive, but it is in the best interest of all of us, because young people often will get infected, but they will not get sick. But once they go home and they get to the elderly and those that have comorbidities, then those will get sick and be affected adversely. So we are making a call to young people to ensure that they actually stick to that. But we have also taken a decision that the security cluster must be very harsh on the events organizers who are organizing these events, because they are deliberately going against what the law says, and we said the law must take its course. So we are calling on our people not to attend, but we are saying the security cluster must implement what needs to be done in relation to that. So what can we do to make sure that we are not in the third wave? Really, it's just maintain the non-pharmaceutical intervention so that we are able to stay away from that. Your second question, look, our interaction with national government as a province is not based on who is the minister or who is the deputy minister. We interact and engage with the national office based on the law, based on the constitution, on what is the role of a provincial government and what is the role of the national government. So the interaction that we have between ourselves as national is always based on that. It actually has no standing or has no linkage with who is the minister at any given time. The number of vaccines or the kind of treatment that we have received as a province, it was not based on the fact that Dr. Mkhize is the minister, but it has been based on the fact that the province is the second largest in the country. So when you distribute vaccines, for example, you distribute according to that. So we would obviously be the second behind Gauteng, because Gauteng has the highest population so far. So are we in the third wave? In the third wave, we are not. The Premier was just reading now, how would we define ourselves? At what point would we then be able to say we are in the third wave? And one of the triggers, or one of the indications that are there, is that a particular number, 10% of the infections rate within the past 10 days is what is looked at. So if within 7 days, not 10 days, 7 days, if within 7 days you go over 10%, it means you are reaching your alert level line. But if you go beyond 20%, it means you are reaching your resurgence line. We are not anywhere near those two as a province. Of course, there are a few districts that from week to week, it looks sometimes like they are about to reach the alert level line, but they don't actually reach there. For this week, it was indicated that only one district looks as if it's reaching that alert level line. So at this point, as a province, we have not reached the third wave, or we are not in the third wave. Why are there more females than males that have been affected? In fact, I think we are speaking in relation to deaths in particular. But in terms of infections generally, we see that females are more infected and affected than the males. So when you use a pedestrian mentality, you would use a mentality that says, because as a province we have a higher population of females than that of males. But we don't want to use a pedestrian mentality. We need to be scientific in our approach. Right now, we have requested a number of our scientists to actually look at that matter for us, because right from the beginning of the first wave, we did notice that our numbers are not in proportion. But you find that you have more females than you do have males. So they are working on that particular research, and as soon as the scientists have been able to give us the report, I suppose we will make it available for everyone to understand. Are our sites safe as the province of KwaZulu-Natal when it comes to vaccination in particular? They certainly are. We have made sure that there is always social distancing. We have made sure that the elderly or the over 60 who come to our facilities do not interact in a manner that jeopardizes their safety and their lives. I know that, Premier, the question is being asked because there is one political party that decided to issue a statement about a week or so ago indicating that Ecklewood in particular, there was no social distancing. It's not true. It's not true, because the different vaccinating sites, as Premier was indicating, that the members of the Executive Council have been tasked to go to districts where they are champions, have been visiting the different sites. We ourselves in the department have also been visiting the different sites, and we have found that all the sites are actually adhering to social distancing. And where there is a number of people who are visiting, there is a system of how to make sure that the different people are not interacting with each other, and there is social distancing that is maintained. On the 17th of May, we visited Royal Showgrounds, which is in Mkungundlovu. It was full, but social distancing was maintained. There was sanitizing on the day, and people were coming in according to the protocols as put in place. We are, though, calling on political parties not to utilize COVID-19 as a political ball game, because this is about people's lives. It is correct that you should raise issues where there are issues, but it should be genuine issues, and it should not be issues that are utilized just so that people or see themselves to be relevant. Sishila katubuza ukuthi kuma vaccinating sites kukhona yini or kuzo vaccinatwa bonke othisha noma kuzo vaccinatwa othisha laba banama comorbidities kuphela. Uhlelo lwethu esulibekile nesulukhuluma nomnyango wezemfundo luthi bonke othisha kufuna ba vaccinate ikakhulukazi ngoba sathi nasithi sesingena ku phase 2 sathi ke ku phase 2 sizo vaccinate bonke abantu sibabiza ngokuthi ba ama frontline workers, so othisha bonke bazo vaccinate. Kodwa isicelo esisenzayo ukuthi othisha bangaveli basuke esikolweni bahambe baye kuma vaccinating sites noma sivuma ukuthi siyavula ngomhla ka9. Inhloko yomnyango yakwa Department of Health nenhloko yomnyango yakwa Department of Education bebehleli iviki lonke leviki esiphuma kulona behlela ukuthi iziphi indlela zokuthi othisha bakwazi ukuthi basondelele kuma vaccination sites abo. So i-management yaka education kwi level ye district iyona izobe sikwazi ukutshela othisha ke ukuthi kulesikolo namhlanje niyogoma endaweni ethize noma kulesikolo sizothatha othisha abahalf bayogoma sishiya abanye. I-intention yokuthi othisha bangaphumi bonke kanye kanye ezikolweni ingoba sifuna ukuthi si affecte ukufunda nokubhala kweingane. So kufuna kube ne process nomuhlelo lokuthi kwenzeka kanjani ukuthi bathi othisha begoma izingane zibe ziqhubeka ifunda. So ngiyacela ngiyabonga nje futhi in fact ukuthi ubuzile leyo mbuzo ngoba kuyafuna sisenze lesicelo ukuthi othisha abangayiphumela esikolweni ngesikhathi nanoma inini bathi bayo vaccinate kodwa abalandele uhlelo ikakhulukazi ngoba njoba bekuhleliwe ngeviki eliphelile bekubheka futhi ukuthi isikolo nesikolo sinayo yini vaccination site eseduze. Uma ngabe ingekho i-vaccinating site eseduze bese kuyahlelwa ke ngokwe district ukuthi sizokwakha i-vaccinating site entsha lapho ukuze othisha bakwazi ukuthi bafike kuyona. Kodwa akuwona wonke ama districts esizohlela kanjalo kuwona. Kwamanye ama districts uma ngabe ingekho i-vaccinating site eseduze but ikhona engekude kakhulu sithatha isinqumo sokuthi ngeswakhe abe maningi ngoba phela nalokho kuyanciphisa ama resources particularly human resource uma sigcina sinama vaccinating site amaningi kakhulu. But sithatha isinqumo sokuthi othisha nabantu abadala abana 6 nangaphezulu uma ngabe vaccinating site yethu inkulu enough sizokwazi ukuthi siba vaccinate endaweni eyodwa sibe nama queues ahlukene and then sikwazi ukuthi siwa maintain. So bonke ke othisha bazo vaccinate kodwa siyacela ukuthi abalindele uhlelo oqhamuka emnyango ukuze likwazi ukuthi lubasize likwazi ukuthi libaguide. Ngicabanga ukuthi baba Mabaso ngiwaphendule wonke ama questions. Khona sir.
Just one follow-up. Just one follow-up. You mentioned there are some healthcare workers who refuse to get vaccinated, which is their right. I just want to know, has it risen to a level where the health department might be worried, or is it just a small number?
Okay.
Yeah, but we the one who are confident that if the current phase 2 are you going to be able to complete it by time?
And so now, now, in terms of registering the elderly with the site vaccination and the technology, has it risen to a level of you worry that some of the older people can't utilize registration via online and there are mitigating circumstances that you can come and try and circumvent that?
All right, let me start with those that are have refused to vaccinate. It has not reached a level where we are extremely worried. It's not a big amount. Like I said, I gave you an example that says 98% of it, and for instance, health workers have vaccinated. So you find that the numbers are not that big. But of course, we do engage with some of them. You often find that in some of the other health workers, it's just firstly worrying about maybe some comorbidities that they have and they believe that might be affected, and where there is such an issue, we are then able to assist them to counsel and probably get proper medical advice from the doctors on whether that particular health worker will be affected adversely or not. So we are working with them on some of the issues. So at this point, we don't believe it is a substantial number that will affect our vaccinating campaign as such. But we call on all of them. Any of the health workers who have worries, they should come forward and be able to talk to us about the issues that they raise. Vusi, will we be able to finish our health workers within our targeted time? Certainly, we believe we will be able, we are confident that we will vaccinate all the health workers that are willing to vaccinate. I think that should be an issue because we can't force anyone. But at this point, when you consider that we are on above 123,000 and our target is about 145,000, so we are very close to reaching our target. I think we've got about quite a few that are left, and once we start this coming week in particular, we believe that we will be finished, but we've given ourselves the end of June to make sure that we are done. I'll come back to you, Vus. I know you said you want something in Zulu, but let me just finish the last question. Oh, okay. No, we are very much aware that not all our senior citizens are computer savvy, firstly, but not all of them have access to the technology that we are talking about. That is why we have been making a call to young people in the community to assist them, firstly in the families, but in the communities as well, to say, can we assist our elderly and get them to register? But we didn't stop there at just making that call. We've also ensured that all our community healthcare workers, they actually go to the communities and register those that are their patients and assist them in getting them into the system. So in our community healthcare workers have been requested to go to their household, the households that they service, and register the 60 plus to become part of the system. But we are still aware that there might be those that will still fall by the wayside even when we have put that system in place. As a result, we have made a call that all those that are 60 years and above, even if they have not registered, they must come to our facilities. Firstly, all our facilities are in a position to register the 60 and above. In other words, you can go to any of the facilities that we have in the province, any of our hospitals, any of our clinics, they will be registered. But it's not all our facilities at this point that are vaccinating. So they can go to any of our clinics to register. They will then be directed to a proper site that actually vaccinates, and they will be vaccinated there. But if they happen to go to a facility that also vaccinates, they will be vaccinated on the spot. So our elderly are able to get into our vaccinating site. They have not registered. We have made a room that there is someone who is there who is able to assist them with registration, and they actually vaccinate, they register them on the spot, and they are vaccinated on the spot. Maybe while I'm on that issue, there's also been a point or a concern that has been raised by some of our 60 and above, that they're saying they have registered, but they had not received an SMS that comes from EVDS to say, come to our facility and get vaccinated. We are making a call that even if you've not received the SMS that calls you to come to our facilities, please come, because as soon as we are sure that you are on the system, we will be able to vaccinate you. So when we say we accept walk-ins, we particularly when it comes to the elderly, we mean we will assist with the registration, but we also assist those who have not received an SMS, because the system is managed at national level, and we have seen over the past few weeks that there has been some challenges. That is why we've then opened ourselves up to say, even if they've not received the SMS that invites them for the vaccination, they can still come and we do vaccinate them. Bamabaso Uvus wanted me to speak in Zulu. I'm not sure which issue he wanted me to address. Okay. No, as Bonge. Into yokuqala njengoba ubweka kahle ngempela sinayo itarget yokuthi abasebenzi bezempilo sizobagoma bonke, futhi kwakubekwe umhla ka ukuphela kaMeyi ukuthi sobe sesibaqedile. Ziningana ke izizathu ezenza ukuthi sigcine siyibona singabaqedanga abasebenzi bezempilo noma singabagomanga bonke abasebenzi bezempilo ngenxa according to i-target yethu. Okokuqala nje ukuthi abasebenzi bezempilo njengawo wonke umuntu eSouth Africa banelungelo lokuthi uma ezithola engekho comfortable ngokuthi ayithathe i-vaccine angavumi ukuthi ayithathe, akaphoqiwe njengabo bonke abantu. So bakhona ke abangabaningi kodwa abangakabi comfortable kahle ngenxa yokuthi i-vaccine yintsha. Abanye bathi inkolo yabo ukuthi inkolo yami ayivumi ukuthi ngiyithathe i-vaccine njengoba sazi ukuthi inkolo zihlukahlukene ezweni. So bakhona abanye abangayithathi i-vaccine. Uyazi ukuthi abanye abantu kwinkolo ezihlukene kuyaye kuthiwe kwesinye isikhathi even igazi nangabe ugula ungavumi ukuthatha igazi lomunye umuntu. So asibaphoqi ke abasebenzi bezempilo ukuthi bathole i-vaccine. Bakhona ke labo abaye basho ukuthi cha abekho comfortable. Bakhona abanye akade bengayithathi i-vaccine ngenxa yokuthi mhlambe bagula ngendlela abacabanga ukuthi izoba affecta uma ngabe beyithatha i-vaccine. Laba banjalo siyaxoxisana nabo, siyaba provider nge-counseling sikwazi ukuthi sibone ukuthi bangasizakala kanjani, including ukuthi bathole i-advice kodokotela ukuthi uma ngabe umuntu enesifo esithize acabanga ukuthi sizomphatha kabi uma esebenzisa i-vaccine kungenze kanjani. So ile category yokuqala ke ileyo yokuthi kukhona labo abangathandi bona ukuthi bayithathe i-vaccine. Kodwa sibese siba nenkinga mhlambe i-element yesibili yokuthi waye singaqedanga abasebenzi bezempilo. Sibese siba nenkinga yokuthi kuzwele onke kubonakala ukuthi i-system le ebhalisa abasebenzi bezempilo, ngoba asikhulumi ngabasebenzi bezempilo be-Department of Health kuphela, sikhuluma ngabasebenzi bezempilo nalabo abasebenza kwi-private sector noma abasebenza abangasebenzeli uhulumeni, bonke kufuna babhalise kwi-system. Kodwa kwase kuyabonakala ke kuzwele onke ukuthi kukhona ezinye indawo okubukeka sengathi system iya-abuseka. Abanye abantu bathi nabebhalisa ayibhalise yena ngoba enesurgery but aphinda abhalise nonkosikazi wakhe, athi unkosikazi wakhe u-receptionist wakhe noma engeyena abhalise nengane yakhe. So kwacaca ukuthi cha i-system yona iya-abuseka. Then unational waseqala ukuthatha isinqumo sokuthi ayikivalwe i-system yokuregister abasebenzi bezempilo okwamanje kuze kube nohlelo olu-clear ukuthi lelo daba lizokwenziwa kanjani. So leyo system ke ibivaliwe ngicabanga ukuthi for the past 2 weeks, kodwa ke sekuyabonakala manje ukuthi kuyaqala kuyalungiswa ukuya phambili. But okwesi-3, uma ngabe ubuka ama-vaccines ebesiwanikiwe as i-province abenganele ukuthi sikwazi ukuthi sikhave. Angiqale ukuthi ukuze nasilontsha ngomhla ka-17 May i-target yethu yawu 79,000 abantu ababezovaccinate. Unational wasinikeza ama-vaccines awu 79,000. Kwaphoqa ukuthi kulo 79,000 kufuna siwuhlukanise phakathi kwabantu abadala nabasebenzi bezempilo. So okwenze ukuthi lokho kusinqande indlela esigijima ngayo, kusinqande nakuthi sigcine sikwazi ukufika kwi-target yethu. Kodwa ke we are confident khona manje ukuthi kuyothi kuphela umhla kaJune sizobe sesikwazile ukwagoma noma ukubavaccinate bonke laba abasebenzela umnyango wezempilo, ikakhulukazi laba abazimisele bona ukuthi bagonywe ngoba asikwazi ukuthi sibaphoqe. Yebo.
No. Thank you. I think there is only Thank you. I think there is only one question that is outstanding. It's what are the lessons we could draw from the previous 2 waves? I think we've emphasized that the first wave was manageable, and we managed it because as community, from different stakeholders, we managed to come together and act in a very united approach. were very united and our approach was quite clear. The message would come from government but spread by all sectors. The weakness which we saw toward the end of the first wave and the beginning of the second wave was the fatigue from people listening on issues of COVID-19 that Norman were tired of this thing. And people wanted to go back to life in a normal way. And that then landed us in a very, very challenging period. And I still feel that the second wave was quite bad and devastating for KwaZulu-Natal in particular. And it was because of that we tend to be tired of following restrictions, and people wanted to do things which were out of control and not in line with the protocols as placed by government. So I think learning from that, it will be important that we all go back, speak in the same language, embrace the approach that the government is spearheading, and ensure discipline. Enforcement will be important, but what is central in this whole campaign is to win the mind and hearts of each and every citizen. To understand that you are not doing this for the government. You are doing it for yourself, because there are still people who say, no, we will wear masks if we go to official events or so. And they become casual with the whole implementation of the protocols. So we want to call on each and every citizen to be more responsible and adhere to protocols. Kafishane siyafisa uqala sibonge bonke abezindaba ngokuqhubeka nokuba ingxenye yomkhankaso wethu okulwa nalolu bhubhane lwe-COVID-19. Sikusho lokhu ngoba njengoba sazi sonke ulwazi lubaluleke kakhulu kulempi esibhekene nayo. So iqhaza labezindaba ekufundiseni nasekwaziseni abantu ngalesifo se-COVID-19 libaluleke kakhulu kulomsebenzi esiwenzayo. Sihlangene la namuhla kule media briefing kulandela izinsuku ezimbalwa la umongameli uPresident Cyril Ramaphosa e-announce ukuthi iSouth Africa izobuyela ku-risk adjusted alert level 2. Lokhu kwenziwe ngokunakekela nangokubhekela impilo zabantu, kwenziwa uhulumeni ngoba enakekela. Kulandela ukuthi kuneyinkomba ezikliye ukuthi izwe lilonke iSouth Africa ibheka ngqo ekutheni ibhekane manje ne-third wave. Amane ama-provinces out of ama-provinces awu-9 already asekhungethwe i-COVID-19. Nakuba thina singakafinyeleli lapho, kodwa izibalo zenyuka ngendlela esithusayo. Ingakho-ke sifisa ukugcizelela ukuthi sonke masilandele imiqathango nemithetho ebekiwe ukuze sikwazi ukuzivikela. Kuleli sonto esiyakulo kumbe kule nyanga sizogubha usuku lwentsha uJune 16 ngaphansi kwaso lesimo esibhekene naso. Siyafisa ukubonga kuhulumeni kazwelonke ukuthi uthathe isinqumo sokuthi lolu suku singathwe lugujwe la KwaZulu-Natal. Sibe sezivumelana ukuthi awube sema-respect lomgubho la sonke siyophelela khona. Sikhumbule ukuthi intsha ibambe iqhaza elingakanani ekwakhiweni kwesizwe, futhi sibuye sibheke ukuthi sesambe kangakanani ekwenzeni impilo zabantu abasha zibe ngcono. Sizomukela umongameli nazo behamba nabo kulomcimbi. Noma kunjalo siyafuna ukugcizelela ukuthi umcimbi ozobanjwa kulandela strictly imigomo le ebekiwe ye-COVID-19. Ukubhekelela intsha yakithi lapha KwaZulu-Natal sakha iKwaZulu-Natal Youth Business Development Fund. Kulonyaka futhi singaqinisekisa ukuthi si-allocate omunye u-50 million ozobhekiswa kulolu hlelo lokuxhasa amabhizinisi abantu abasha. Ngephase yokuqala kwabonakala inkampani ibenefita zibaningana. Lokho kuholele ekutheni kube nabantu abasha abangena ngqo emathubeni emisebenzi, bakhande abangena kumabhizinisi, bakhande namathuba emisebenzi. Siyafuna-ke ukuthi sigqugquzele ukuthi intsha iqhubeke i-applye ikwazi ukuhlomula kulolu xhaso. Sibonile uthulwa izibalo zesimo soqashwa nokuswelakala kwemisebenzi ukuthi liya ngokunyuka kakhulu inani labantu abangasebenzi. Noma kunjalo siyafisa ukubonga ukuthi KwaZulu-Natal kuneyinkampani ezinkulu ezikhombisa isasasa lokutshala izimboni zazo la KwaZulu-Natal. Singabala iNyanza Light Metal ese-Richards Bay Industrial Development Zone eqalile ngoMarch ukwakha indawo yabo enkulu eyiplant yokuthi bakwazi ukusebenzela khona ekwivalue ka-4.5 billion. Ne-Wilma inkampani eproducer u-oyela from ama-vegetables eyenza i-investment ka-1.3 billion ezokhanda imisebenzi engu-202 epermanent. Siyazi ukuthi futhi uhulumeni waKwaZulu-Natal uke wavakashela iPepco Logistic okuyifacility elapha eKeystone Business Park eHammersdale ene-investment e-1.5 ezokwakha amathuba emisebenzi angu-2,200. Notify eMnambithi uqhubekile nokutshala ukukhulisa indawo yabo ngokwakha istorage esikhulu oku-ede amathuba emisebenzi angu-130. Siyazi futhi ukuthi business processing outsourcing bayaqhubeka nema-call centers abo and asesikhandele amathuba angu-15,000 emisebenzi. Siyaqhubeka nokukhulisa i-airport siyenze isebenze ngokwezinga eliphezulu nangokushesha. Siyaqhubeka nemikhankaso yokulekelela ukuthi osomabhizinisi bakwazi ukuthola usizo lokwenza ama-project abo, especially labo abafisa ukuboleka imali. Kuleli sonto esiphuma kulo sisayine izivumelwano ne-African Bank encourage kumbe eqhuquzela ukuthi abantu basebenze imikhiqizo mase bekwazi ukuthumela imikhiqizo yabo eAfrica iyonke. Leli yelinye lamabhenka izikhondla eAfrica elikwazi ukusiza abantu abafuna ukungena ekhiqizini phecelezi imanufacturing. Siyafuna ukuthi sigcizelele ukuthi abantu bakithi abalithathe ithuba bangayekeleli nje kube inkampani ezinkulu kuphela ezithatha lamathuba. Siphatheke kabi kakhulu ngezinto esizibona zenzeka eRichards Bay Mineral. Lokhu kubala ukubulawa kwabasebenzi nabaphathi ngesikhathi sibone kubulawa ubaba uNico Swart. Sihambele noMinister uMantashe siyozwakalisa amazwi okuzwelana nenkampani nomndeni. But kusiphathe kabi kakhulu kubuye sibona kushiswa impahla yokusebenza yenkampani iRBM. Siyafisa ukugcizelela ukuthi amaphoyisa kuzomela asebenze ngokuyimisela bambe bonke aba-involve kulezi zehlakalo ezisibuyisele emumva kangaka. Siyafuna ukugcizelela kubantu bonke ukuthi abazi ukuthi uma kungenzeka iRichards Bay igcine ngokuthi ithi iyavala, kuyoba nabaningi abaswela amathuba emisebenzi nemndeni eyophila kanzima kulandela ukuvalwa kwayo iRBM okuyokhanda umpofu eindaweni eziningi. Siyafisa ukugcizelela ukuthi lamathuba emisebenzi avelayo nalama investment avelayo asikwazi ukuwabamba ngezandla zombili, kuthi la sineyingxaki khona noma sibona bengenzi kahle sixoxisane ngendlela eyakhayo sikwazi ukunqanda ukuthi bashiye noma bathole kungasasebenziki. Ukuphela kwemisebenzi kukhandwa indlela abantu bebhizinisi abasibuka ngayo njengezwe nanjengeprovince yaKwaZulu-Natal. Uma ke singena kudaba lolu lwe-COVID-19 sikaqinisekisa ukuthi sinezikhungo manje ezingu-124 kumanje zivaccinate abantu and kulazikhungo sinezinye ezingu-18 ze-private sector. Sesivaccinate abantu abangaphezulu ka-360,451. Laba bavela ku-237,195 okungabantu abadala aba more than 60 nabasebenzi abavela emnyangweni wezempilo abangaphezulu ka-123,256. Sihleleke manje ukuthi simuvele ekutheni kugonywe awothisha ngoba bayingxenye yabantu ababalekile abathintana nemphakathi isikhathi nesikhathi. Sizothola imigomo ecela ku-110,400 ye-Johnson & Johnson ezobe dedicated for othisha. Bazokwaziswa per second ukuthi bazoya nini kogoma maphi, kodwa kubalekile ukuthi bonke babhalise. Siphatheke kabi ukubona ukuthi kwezinye izikole kuba khona ama-infections aza kube yi-cluster njengoba sibonile kwesinye sezikole ezisemzinyathi kureportwa ama-cases awu-16 nesinye sezikole othukela kwareportwa ama-cases awu-15. Njengamanje uma sibheka amahora awu-24 adlule kuyasikhombisa ukuthi ama-cases e-COVID-19 aya ngokwenyuka ngoba ku-24 hours lodlule sirekhode 227 cases. Kuzokhumuleka ukuthi isibalo bese siphansi kakhulu sesiba ngosuku sibe ngaphansi ka-100. Uma ke sesibuyela kule number ukhombisa ukuthi izibalo ziyanyuka. Njengamanje ama-cases asekhona KwaZulu-Natal wonke angu-340,586. Okusidabukisayo futhi ukuthi sesilahlekelwe imphefumulo engaphezulu ka-10,534. Siyanxusa siyacela kubantu bonke ukuthi masibamsaneni ukugwema ukuthi lesifo sisibuyisele emumva size sisigabhe sibe ngaphe kwethu sifinyelele kwi-third wave. Nakuba singakabi kwi-third wave kodwa siyaxwayisa ukuthi ukunyuka kweyinamba kusiphatha kabi. Kumele sonke sizame ukwenza esingakwenza silandele imigomo ebekiwe. Sinalo uhlelo oludidiyele olubheka ukuthi sidila kanjani ne-third wave. Okokuqala ukuthi sitheste bonke abantu abasola ukuthi kungenze ukuthi bathelelekile. Size sitheste nama-contact abo. Si-isolate labo abaphethwe isifo se-COVID-19 nalabo abakwi-self-isolation emakhaya bonke sibamonithe. Siqhubezele phambili ukuthi sitrace abantu laba abake bathintana nabantu abanesifo se-COVID-19. Maqede si-increase numbers zembhede ey'bhedlela zethu ey'bhekene ne-COVID-19. Siqinisekise ukuthi i-oxygen iyatholakala mase siqhubezela phambili ukuthi abantu bakithi bathole imigomo. Siyagcizelela ukuthi o-MEC no-Mayor, amakhansela, nama-war rooms operation sukuma sakhe, akasukume aqinisekise ukuthi encourage abantu siyabagqugquzela ukuthi babhalisele ukuyogonywa. Indlela ezosinceda ukuthi singangeni kwi-third wave ukulandela yonke imigomo ebekiwe, imigomo yokusebenzisa ama-mask, ukusanitizer nokuwasha izandla ngamanzi nensipho, ukuthi sigweme indawo ezinabantu abaningi, okugcina ukuthi sivaccinate. Kusezandleni nasemandleni ethu sonke ukuthi sikwazi ukuqikekela ukuthi i-third wave ayisifici futhi ayisigubezeli njengekwaZulu-Natal. Umuntu nomuntu uneqhaza ukuzodinga libambe ekutheni lesi sifo singabi nzima, sikwazi ukwehlisa izinamba. Asingayitholi sesibhekene nestorm njengoba sikhumbula ukuthi i-second wave yasishaya kabi kakhulu. I-second wave idlule nemphefumulo yabantu eminingi. I-second wave isishiye sikhahlamezeke kakhulu. Sinxusa bonke-ke abantu bakwaZulu-Natal ukuthi baqikelele, masiqinisekise ukuthi siyaqhubeka sigqoka ama-mask, sisanitize, siwashe izandla, siqikekele ukuthi imicimbi enabantu abaningi siyayigwema, silandele yonke imigomo ngokubekwa kwayo, siye kuma-vaccination centers sithole ukuvaccinatwa, ukugonywa nathi. Kusezandleni nasemandleni ethu ngamunye ngamunye as abantu bakwaZulu-Natal, ngokubambisana sizoyinqoba i-COVID-19. Siyabonga.
Thank you very much, Chairman, despite the colleagues' medicine. Thank you very much.